Good afternoon, everyone. Good afternoon, everyone, and thank you for joining IPAC Canada's election webinar, A Stronger and More Prepared Canada. My name is Zahir Hirji, and I'm the president of IPAC Canada, and it's my pleasure to be moderating today's discussion. IPAC Canada recognizes that its headquarters are located on Treaty 1 territory, the traditional lands of the Anishinaabe, Ojibwe, Ininiwe, Cree, Oji-Cree, Dene, and Dakota, and is the birthplace of the Métis Nation and the hearts of the Métis Nation homeland. We acknowledge that we have members and attendees joining us today from across Canada, and many may be in a different territory. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. We acknowledge the harms and mistakes of the past and consider how we are and can each, in our own way, try to move forward in a spirit of reconciliation and collaboration. IPAC Canada is pleased to offer today's webinar in order to discuss our election priorities and other emerging healthcare-related issues that are being discussed during the federal election campaign in the lead-up to the election next week. Just a few housekeeping reminders before we jump into the discussion. Please enter your questions into the question and answer section at the bottom of your Zoom screen. We'll address as many questions as time allows. You can also use the chat for general commentary and for general discussion, but we do ask that you please use the question and answer and chat only for relevant topics for today's discussion. This event is being recorded and will be made available on strongerandprepared.ca and sent out to all IPAC Canada members. And with that, it is my pleasure to introduce today's panelists. Today, I'm joined by two of my colleagues on the IPAC Canada board, Colette Ouellet and Jennifer Happe. Colette is the president-elect of IPAC Canada and current director of IPAC Canada of Infection Prevention and Control, Quality, Patient Safety, and Risk Management at the Queensway Carleton Hospital in Ottawa. And Jennifer is the secretary and membership director of IPAC Canada on the IPAC Canada board and is the chair of the Surveillance and Applied Epidemiology Interest Group, as well as an ICP with the Alberta Health Service. Welcome to both of you. Today, we also have Eric Grenier, who is the author of The Writ, who will be joining us as our special guest. On The Writ, Eric writes about everything from by-elections taking place in small provincial ridings to national campaigns that can reshape the course of history. He has been writing about electoral politics since 2008 and has written for publications like the Globe and Mail, the Huffington Post Canada, and the Hill Times. He was also the CBC's polls analyst, working out of the Parliamentary Bureau from 2014 to 2021. He is a member of the Parliamentary Press Gallery and is a regular contributor to TV and radio programs on CBC. Eric is moving from one event to another today, and so he'll be joining us shortly. But with that, let's dive into the IPAC Canada election priorities with our current guests. Colette, we'll start with you. One of IPAC Canada's election priorities is calling for increased resources to the provinces and territories to fund robust infection prevention and control activities, improve patient safety in Canada, and support our efforts to curb the rise of antibiotic-resistant organisms and antimicrobial resistance. Can you tell us a little bit more about which resources are needed?
Yes, thank you, Zahir. Good afternoon, everybody. As Zahir has noted, IPAC Canada is appealing to the federal government to invest in resources for infection prevention and control programs in order to better support Canada's systems of care, minimize future healthcare costs, and improve pandemic preparedness for the next time. Our current government has demonstrated a real willingness and ability to urgently invest in certain areas of healthcare in response to the pandemic, particularly related to the social determinants of health. The largest supports by far have been for personal incomes and businesses to help individual Canadians and the economy bridge the gap to a post-pandemic world. And while undeniable attention is being paid to investments in personal protective equipment, vaccines, and long-term care, much more needs to be done to adequately resource and support IPAC programs across Canada. Previous funding cuts to IPAC programs exposed significant gaps in Canada's systems of care during the pandemic. Across the country, infection control professionals are in short supply and are under-resourced. And the education and training for healthcare settings simply is not available to the degree they need. We don't need to look far beyond the abysmal situation in long-term care in Canada to know that infection control programs are sorely lacking. CIHI reported that 80% of all COVID deaths in Canada were in long-term care, while other OECD countries, including the US, Germany, France, the UK, and Italy, among others, averaged 38%. Almost 10,000 long-term care health workers were infected with COVID-19, and these reports were in May of 2020, relatively early days in the pandemic. Clearly deficient in the long-term care sector was effective IPAC resources. It's a bit reassuring to see during the election run-up that all the parties are talking about recovery from the pandemic within their platforms, to one extent or another. And if you want to see a full outline of each of the party platforms as they relate to IPAC issues, you can refer to the Elections 2021 page on the IPAC Canada website. Among other things, the Liberals and NDP favor a vaccine mandate. The Conservatives have committed to immediately providing more rapid testing at borders and making at-home rapid tests available to all Canadians. The NDP and the Greens are looking toward more domestic production of personal protective equipment and of vaccinations. All of this is good, but much of it is narrowly focused on COVID-19. And not only do we have to prepare for the next inevitable pandemic, we also have to address long-standing gaps in healthcare and maximize the potential of IPAC programs across the country with resources, with investment and support. Those of us practicing in 2003 recall that following SARS, proclamations were made in Canada that we would never again be so ill-prepared for a large-scale public health crisis. But in less than 20 years, we found ourselves lacking the resources for guidance and support on the front lines of healthcare. You'll have to excuse me, I'm having some computer difficulties. Zahir, could I ask you to step in for just a moment?
Sure. Colette, we'll just wait till you're able to come back. Thank you for sharing some of those priorities. I know that we have been using our opportunities at IPAC Canada to be able to influence many of the electoral candidates that are up for election this year. In fact, Hill Day was quite successful for IPAC Canada in being able to meet possibly one of the silver linings of COVID, our ability to be able to meet with so many more of the candidates because of the virtual option really did offer us a new opportunity.
It did. Thank you, Zahir. My apologies.
No problem.
I was speaking about our experience during SARS and the unfortunate situation that we found ourselves in when the COVID-19 pandemic hit. And in addition to the issues around pandemic planning, we've lost traction in our fight against antimicrobial resistance and other emerging infectious issues that threaten the health of Canadians. Now, a major concern when lobbying the federal government for financial support in healthcare, particularly when asking for it to be earmarked for a specific function like infection prevention and control, lies in the constitutional responsibility and right of provinces to administer and deliver healthcare to their populations. And there are parties and individuals who vehemently oppose having specifications attached to any funding the provinces receive through the health transfer. But it's not unprecedented to have monies dedicated to a specific need, particularly when it's a widespread national need. For instance, in the 2017-18 budget, there was funding of $11 billion over 10 years, specifically identified within the transfer for mental health. This was facilitated with bilateral agreements between the feds and the provinces to improve home and community care and mental health and addiction services. And that same model could be used to bolster infection prevention and control services and program support across the country, because it is needed to improve pandemic preparedness, protect long-term care residents and staff, and support the health of all Canadians. From IPAC Canada's perspective, this is about creating reliable long-term funding that IPAC programs across the country can rely on, which will benefit Canadians as a whole in ensuring that Canada is better prepared to respond to prevent, and to control public health crises. Microorganisms don't respect provincial boundaries. We anticipate that a dedicated stream of funding like this would involve plenty of consultation and negotiation with the provinces. And we believe that now is the time to begin these critical conversations. IPAC Canada is calling on the federal government to provide more resources to the provinces and territories to fund robust infection prevention and control activities, improve patient safety, and support our efforts to curb the rise of antimicrobial resistance. Thanks, Zahir.
Thank you so much, Colette. We'll be back to you shortly, but why don't I turn to Jennifer now, who is going to talk a little bit about our second priority. I have a couple of questions for you, Jennifer. In particular, our second priority for this election has been the integrated and national surveillance system to ensure that Canadians are protected from infectious diseases no matter where they live. My first question is, can you give us a little bit of the current state of surveillance in Canada and which gaps need to be filled?
Thanks, Zahir. Surveillance is a core component of infection control, and in this context, we're referring to surveillance of HAIs, or healthcare-associated infections. These are infections, as I'm sure you know, that are acquired during the delivery of healthcare, and they're actually the most frequently reported adverse event in healthcare delivery worldwide. Preventing HAIs is at the heart of what we do and why infection control exists. The process for measuring and reporting HAIs currently really varies with each jurisdiction. Everybody is responsible for determining what data they're going to collect, where they're going to collect the data from. So will that be acute or long-term care? How they're going to gather the data? So will they use a trained professional like an ICP, or will they make use of something like an electronic discharge abstract database? And of course, everybody makes their own choice about how to report the data, including who to share the data with and at what frequency. This variability in surveillance practices really limits national comparability and benchmarking. There are efforts being made to collect a national data set through the Canadian Nosocomial Infection Surveillance Program, better known as CNISP. CNISP is managed by the Public Health Agency of Canada, and they're funded by the federal government. CNISP has been working for almost 30 years to gather data on HAI events in select acute care facilities across Canada, but currently less than 100 acute care centers routinely contribute data and no long-term care centers participate. Colette touched on how some political parties plan to support some infection control activities, but unfortunately, none of the party platforms recognize the need to improve our national surveillance system by addressing the gaps that you asked about, Zahir, and there are three key gaps that need to be addressed. The first is to establish standardized case definitions for HAIs, both for the acute but also the long-term care setting. This is important because it will ensure that our data is comparable both within and between jurisdictions. The next gap is widespread adoption and application of these case definitions. This will really ensure that we're collecting the same set of data to measure trends in HAIs and establish benchmarks. And finally, and this is a big one, we have to establish an expanded national surveillance program that includes IT infrastructure and human resources in order to collect, analyze, and prepare timely reports of our HAI data.
Thank you, Jennifer. Can you expand a little bit about how the current COVID-19 pandemic can illustrate the benefits of a national surveillance system and what it might have been able to offer us?
Sure. So the Public Health Agency of Canada, who again is funded by the federal government, developed a passive population-based surveillance system in order to monitor COVID-19 activity in Canada. Provinces and territories currently report confirmed and probable cases to the agency using electronic data that are extracted from their existing provincial and territorial information systems. The objective of the national COVID surveillance system includes assessing the spread of COVID, measuring morbidity and mortality, and identifying vulnerable populations. And this collaboration in surveillance, monitoring, and reporting across Canada has been really critical to informing infection control efforts and measuring their efficacy, including things like immunization, public health protocols, and guiding allocation of financial and human resources. For instance, health transfers and deployment of the Canadian Armed Forces to long-term care centers in Ontario and Quebec. The collaboration that's been exhibited between jurisdictions for COVID surveillance is also needed for HAI surveillance. Like COVID, it will allow us to better understand the scope and impact of HAIs in Canada, and it will support the development of policies, procedures, and interventions, as well as help decision makers figure out how to best allocate resources to curb HAIs. Of course, it will also facilitate cross-organizational learning and increase accountability and transparency.
Thank you, Jennifer. And finally, can you tell the audience a little bit about how IPAC Canada is helping to build an integrated national surveillance system?
Sure, there are really three main avenues that IPAC Canada has been using to support this goal. IPAC has been advocating with provincial and territorial and federal health ministers for an expanded surveillance system for the last few years. This includes financial, IT, and human resource support. We've written letters and we've met with ministers in person or via Zoom during the pandemic to advocate for their support. Of course, our goal is not to take autonomy away from local jurisdictions, but simply to establish a minimum data set that we can all contribute to. Beyond that, provinces and territories should be able to gather and report on infections and conditions as is really warranted by local epidemiology. Now, IPAC Canada has also gone so far as to prepare and publish a set of surveillance definitions specific to long-term care facilities, given that CNISP has already established acute care definitions. Further to this, in partnership with Public Health Ontario, IPAC Canada has published a long-term care surveillance toolkit to support long-term care facilities with assessing their readiness to conduct surveillance and going about collecting and reporting the data. Now, finally, IPAC Canada importantly has partnered with key stakeholders like Healthcare Excellence Canada, the Public Health Agency of Canada, and the Canadian Institute for Health Information in order to establish a pan-Canadian Surveillance Advisory Committee. IPAC Canada co-chairs this advisory body whose goals are really to tackle the gaps that I mentioned earlier, including widespread adoption and application of the CNISP acute care definitions, as well as the IPAC Canada long-term care definitions. And of course, we hope to explore and test several different options for improved collection, analysis, and reporting of HAI data across Canada. So these are some pretty lofty goals that really in part cannot be achieved without political will and tangible support.
Thank you so much, Jennifer. The epidemiologist in me at heart is really tied to this particular objective. And so I'm hoping that we'll be able to leverage the current pandemic to be able to make some movement on that. And with that, what I'd like to do is be able to turn over to our special guest, Eric Grenier. Thank you so much for joining us today. I did tell the audience a little bit about yourself, and so I'll move right into a question that we have for you, if I could. And if you could start off by telling us a little bit about where the current polls stand in the election nationally and how healthcare issues have been discussed and are being perceived in the election.
Yeah, absolutely. And thanks so much for having me. I'm happy to speak to you. Yeah, just to give you a rundown of where the current race stands, because the outcome of this election is really still in the balance, right? And if we're heading towards a minority government, which we are possibly doing, it does open up some opportunities, I think, for leverage of the political parties to try to get them to move on certain issues. Right now, the Liberals and the Conservatives are effectively tied in the polls nationally. There was a point in the campaign earlier on where the Conservatives were moving ahead. That momentum that Erin O'Toole seemed to have built has receded. The Liberals and the Conservatives are now neck and neck. You would still expect, though, that the Liberals could probably turn this into another minority government. If you think about the last election in 2019, the Liberals lost the popular vote, still won a pretty sizable minority. So the fact that they're currently tied, you'd still give the edge to the Liberals, even to the point where if the Conservatives move 2 or 3 or 4 points ahead, you could still imagine that the Liberals would get more seats out of this. The race has been for the NDP, for the Bloc Québécois. They haven't really made much of an impact on the race so far, though the Bloc has made some gains. And I know, I was listening to the previous speakers talking a lot about jurisdictional issues and, the question of giving money to the provinces with or without conditions. The Bloc does seem to be in a position where they could have a big impact on the outcome of this election. Their numbers have improved over the last week or so, and it does suggest that they're likely to get nearly as many seats as they had last time, which means they'll still have a balance of power, if not the balance of power in the House of Commons. So those jurisdictional issues about handing money to the provinces for healthcare and whether there can be conditions on them, I think would be one that whether it's Erin O'Toole or Justin Trudeau, who is the Prime Minister, is probably still going to be pretty sensitive about. One of the other issues with this campaign, which is a bit of an unknown, is the role of the PPC. And I know that with the protests we've seen recently outside of hospitals, it's particularly, it is a thing happening in this campaign that this party has come out of nowhere. And the latest polls do suggest that they could have a pretty big impact on the results. I would say it's still very unlikely that they're likely to win a seat, but they have been about 6 or 7%. It does seem to be hurting the Conservatives. And if we see, for example, an outcome where the Liberals win, the Conservatives might be asking themselves about the strategy they had in this election campaign to move to the center, whether that opened up an opportunity for parties further to the right. So what that would mean for a post-election Conservative Party and what positions they would take on some of these issues, remains to be seen. Healthcare is a big issue in this election campaign. Poll after poll always puts it in the top 3, if not the top position. The issue is that, again, because of these jurisdictional issues, I think that healthcare is seen as, for people, a big issue in their lives. And it can be the kind of issue that really turns a provincial election, because that is where I think a lot of voters see the role of healthcare and politics and voting come together. We saw that just recently in the Nova Scotia election just a few weeks ago. The Liberals, the incumbent government there, they were planning to run on their pretty successful handling of the pandemic, things like on childcare. They'd signed an agreement with the federal government, but the Progressive Conservative government party decided to go pretty much all in on healthcare. There was a big waiting lists in Nova Scotia for getting doctors. There was concerns about getting emergency services. And Tim Houston, the new premier of Nova Scotia, he decided that he was going to really make this election about healthcare. In some ways, he was running really to the left of the Liberal Party on this issue, and he won an upset victory. So it does show how healthcare can be used in politics to win elections. Federally, I'm not so sure there is as much room to maneuver here, because we've seen the party leaders talk a lot about healthcare funding, but it's often in terms of dollar figures. It's often in terms of whether there'll be conditions or not. And for a lot of voters, big numbers don't mean a lot to voters, right? $6 billion, $5 billion, what does that mean to me? I don't know. So I think that's why it can be somewhat of a difficult issue to really galvanize people during an election campaign. The pandemic has been a huge issue. It is still polling quite high as a top issue for Canadians. And I think that what we've seen in the polling over the last year and a half is that there is an appetite, I think, for Canadians to see national cooperation when it comes to dealing with these kinds of issues. That in provinces, especially provinces where things did not go particularly well, the federal government's handling of the pandemic got better marks. It's only really in places like Quebec and Atlantic Canada, and sometimes in BC, where people thought the provincial government did a better job. So I think there's certainly that kind of appetite for voters. But it is still that old balance of the jurisdictional issues, Quebec, some of the other provinces that have problems with the federal government intervening there. And in a scenario where Quebec is still a pretty big factor in an election campaign, I think the parties are always going to step a little bit lightly when it comes to getting into provincial jurisdiction.
Thank you so much, Eric, for the overview. With those three presentations, we'll move into the question and answer. And so I'll encourage our audience to post in the question and answer to help me a little bit, and post some questions in the question and answer down below, and we'll be able to ask our candidates that. Maybe what I'll start off with, Eric, and this has actually been a conversation here at my house. We often see that healthcare issues are top of mind among Canadians, and then there's some discussion at different points at the federal election. But I think many people have assumed that issues like healthcare and COVID response and pandemic preparedness would be top of mind at this election. But sometimes what I'm hearing is more discussion about when the election was called, the fact that it was done during a pandemic, and sort of all of the stress that it has resulted in that. And so has that ended up overshadowing, or what are your comments or some of your experience around how that might end up impacting the election, and how we might be able to bring it back to healthcare issues?
Yeah, healthcare has not really been a big issue in this campaign. Even the pandemic hasn't been that big of an issue. It has been focused on a lot of other things. I think for the healthcare issue, the problem is that for the federal parties, I'm not sure if they know what they can do that they can sell to voters. It's one thing just to say we're going to hand over this amount of money to governments and we'll help fund healthcare. But you can't differentiate yourself between parties all that much. You're just getting about whether you're going to give more money or less money. And so I think that for political parties, they know that they need to have something on healthcare. They need to show that they're putting money into the healthcare system because people really do care about that. But I think that when they're looking at their electoral strategy, they see other issues as being more likely to move people around. Because if there isn't that much distinction between the Conservatives or the Liberals in terms of how much money they'll give to the healthcare system, because we're talking again about such big numbers, it's hard for people to grasp what those big numbers mean and the differences. It's easier to talk about whether this election should have happened and whether that means you can trust the prime minister or the other party leaders on it. It's easier to talk about contradictions on gun control or on climate change policy, the kind of things that people care about and can be much more of a red line. I think that's one of the things here is that everybody agrees healthcare needs to have more funding, that the system needs to be strengthened. Everybody agrees on that. All the parties agree on that. But it's easier to point out to someone that, well, if you want to vote for a party that doesn't like gun control, you have this option, you have this option. That's the kind of thing where people say, well, that's the kind of thing that makes the difference between me voting or not for that party. So I think that parties tends to focus on those issues rather than the ones that everybody agrees on, there's a consensus on, and it just gets down into the details. It's hard to win an election on details.
Thank you for that. Why don't I ask, so Colette, can you help us a little bit with the focus on healthcare in this election? How does an organization like IPAC Canada ensure that the focus is sustained so that we can start to see real and long-lasting change?
Yeah, thank you, Zahir. I think you alluded to this when you stepped in on my behalf. Thank you. That IPAC Canada is involved in what we call Hill Day. It's an event that takes place every year that gives us an opportunity to speak directly with federal representatives from all parties to ensure that they are aware of and understand the need for more robust infection prevention and control resources and support. In addition, IPAC Canada produces a pre-budget submission to the sitting government to make specific recommendations for infection prevention and control allocations within the annual budget. And the issues that we spoke to today, requiring more robust funding for infection control and requiring a surveillance system that's national in scope, have both been part of our submission this year to the 2021 budget. But I think we each individually have a voice to ensure that change is effected and that it's sustained through our local politicians. And I would suggest to anybody on this call, if you're interested and willing to write to your representative, IPAC Canada has actually crafted a detailed letter that you can easily send to your federal representatives by simply entering your address on the website. You know, change it's made strong through advocacy by the organization, but also strong advocacy by each individual.
Thank you for that, Colette. I'm just reading actually one of the questions that's come up. And so Colette, I'll ask for you if you can sort of expand. The role of public health has played an enormous role in the pandemic as well as infection prevention and control. And as public health only receives about 5% of the healthcare budget, is there any advocacy planned or happening to support the increase in public health budget for prevention services and measures?
Yes, so through our budget submission, that's a fait accompli, has gone in already. Certainly the role of the Public Health Agency of Canada is quite strong, and we use their support during our efforts to meet with the federal government. On an individual level, public health units fall into that same provincial jurisdiction that we've already spoken to in this discussion. So on a federal level, certainly there is a role for the Public Health Agency of Canada, and we support those efforts, and indeed they support us in our efforts. But locally, we don't have the same strength of voice that we require.
Thank you, Colette. There's another question that's come through, and so I'll, if I can ask, I'll ask it to all the panelists. Jennifer, if I could start off with you. Although it's understandable that healthcare is a provincial responsibility, do panelists feel that public health, including pandemic preparedness and disease surveillance, like healthcare-associated infections, should be a federal responsibility? Jennifer.
Yeah, thanks for the question, boys. That's a good one. And certainly that's one of the major barriers that we have run into in trying to affect some change regarding building a comprehensive national surveillance system to capture data on some of our most important communicable diseases. We have run into that barrier where each province and territory wants to do their own thing. And even within some provinces and territories, there is division about what communicable disease information to capture and in what populations they're going to gather that data and how they're going to report that data. So certainly when it comes to things like COVID-19, there has been a global recognition that this is vital information that needs to be shared at a national level in order to be able to create effective strategies to curb this pandemic. And I think would love to see something in the future where the federal government, does take a stand and does require provincial and territorial jurisdictions to be able to contribute to something like a national data set on HAIs. To date, though, there just hasn't been a lot of appetite for that. And, perhaps Eric can speak more to the division of responsibilities between the federal levels and the provincial territorial levels, but they often, it seems to me, to be walking a little bit on eggshells at the federal level when it comes to dictating what happens at the levels below them. And I do think that that has created a bit of a barrier, but I'm hopeful, as Colette has mentioned, that with our continued advocacy efforts, we will be able to leverage what has happened with the COVID pandemic into transforming other aspects of the public health system.
Thanks, Jennifer. Eric, can I maybe ask you next?
Yeah, sure. I think that the pandemic definitely showed that there is pretty broad opinion on a lot of these issues. When we were looking at, polling about, various lockdowns, various restrictions, things like that, you didn't see the same kind of regional disparity in people's views on them as you did sometimes hear from the premiers. And I think that's one of the issues here, is that a lot of it is politics, right? If Jason Kenney and Justin Trudeau, they do not get very well along, the Prime Minister and the Premier of Alberta. If it had been two leaders who got along a lot better, there would probably be a lot less friction in the federal government asking or telling provincial governments to do anything. We saw just recently that when the health minister was criticizing Alberta's move to open up over the summer, and that caused a lot of issues, which now the health officer has recognized. The premier more or less rejected that he could take advice from the federal government. So unfortunately, it is a lot of politics that is at play here, because often whenever the federal government decides that it is giving money in a way that does interfere with provincial jurisdiction, if the province agrees with the money and what the money's going towards, then they don't usually mind. It's usually just when it is something that they don't want to spend money on. And you even hear that from Quebec. While Quebec is going to always be the one that is trying to protect its jurisdiction more than the other provinces, I think that there would be the possibility that if there was a broad consensus among people living across the country on having these kinds of national surveillance and data collection, that there might be a lot less reticence for the premiers to get in the way. But a lot of this is largely politics and not so much on the policy itself.
Thank you.
If I could add, Zahir,
Sure.
I really believe that this is a situation that requires partnership. And it's a team effort. Every level of government has to support our efforts, particularly in pandemics, in communicable diseases. I mentioned earlier, we all know that the microbes don't know the barriers and the politics, and they move pretty freely among the population. It doesn't matter which province you're in. So if we don't have a good partnership between the province territories and the federal government in developing the standards, in ensuring that we all have resources, in ensuring that all Canadians are protected, we're not going to be very effective in efficiently winning these battles. I think communicable disease is a separate entity to much of the health politics, and that it should stand separately because it behaves differently, and it requires that partnership, and it requires that global oversight to keep all Canadians safe.
Thanks for adding that, Colette. If I could, what I wanted to do is circle back to Colette's initial discussion around our advocacy and what we're doing to be able to influence our political members. Eric, do you have additional things that you would recommend to an organization like us that we might consider doing, or other things that we should be leveraging or trying to reach out and actively do to be able to get, in particular, these two priorities around increased funding directly for infection prevention and control and a national surveillance system pushed a little further, in particular, because the national surveillance system one we've had on our agenda for a number of years. And so if through your experience, if you had other suggestions, we'd love to hear.
Well, I'm sure that I've no doubt that the pandemic should make it easier, because I think that prior to this, I think there would have been a lot more reticence about the need for this kind of thing, because I think that a lot of Canadians, quite perhaps understandably, if mistakenly, thought that something like this was not likely to happen and wouldn't be needed. But I think now there's going to be much more of an appetite for that kind of thinking. So I think that there is the possibility that programs that are of national scope can get support from the federal parties, because I think people want to make sure that their government is going to do whatever it can to prevent this kind of thing from happening again. And if it does, that we have much more of an integrated response to it. Because one of the things that I think a lot of people were upset about during the pandemic was the patchwork of policies, of responses, of information that was coming out. If we end up with another minority government, there is going to be the chance for more leverage of individual MPs, because while it's extremely rare for some MPs to deviate from the party line, there are some who are willing to do it. And if the result of the election turns out to be very, very close, where it is a matter of a few seats, it would be possible to get some MPs to maybe not vote against their party, but raise their voice a little bit more within caucus to the extent that they might be willing to move over to them. You think of someone like Nathaniel Erskine-Smith, who's a Liberal MP in Toronto. He's been someone who has deviated from the party quite a bit, but has stayed on side with them. And I think he's been quite effective in representing his constituents' views. He is someone who's very big on animal welfare, just for an example, and he's been able to try to push that forward. So I think if you can identify those MPs who went to Parliament with more of an idea of doing something good, of making change, rather than just being a member of the team, I think there is still the opportunity to have them be a voice in Parliament, and especially in a minority government.
If I could, Eric, I know you indicated that most Canadians would expect their government to do what they can to avoid this situation from happening again. I would suggest that most Canadians were unaware that we don't have a national surveillance system, and we don't have in place the tools that we need to assess baseline rates of organisms and see some of these things coming. And I think, therefore, it's incumbent on all of us to have that very loud voice to make sure we're heard, that this is a need and that the population expects that of our government, that this is just a baseline effort that one would think the government has well in hand. Indeed, we don't.
Thanks for adding that, Colette. I think it's true. I do think that there some of what we may need to be doing is advocating amongst our community around the fact that we need them to be able to partner with us to be able to advocate for some of this, rather than it just looking like it's coming to or from infection control departments. We also have someone who's in behind a guest who helps IPAC Canada quite a bit. So I'd like to introduce Brianna Workman, if she would like to add a little bit about some of the work that we are partnering with Impact to be able to advocate on these particular priorities.
Thanks, Zahir. Yeah, just with a couple of the questions about kind of future advocacy for IPAC Canada, I said to Zahir, I'm happy to jump in here. I believe this is some of the earlier questions, but just wanted to highlight, of course, as Colette has said, we did put in a pre-budget submission in August because that is when the House of Commons Finance Committee asks for them. But with an election, there is a lot of post-election advocacy that will become top priority immediately on September 21st, once the dust settles from this. And so while that submission is in, particularly with a new parliament and likely some new MPs, perhaps a new government, we'll have to wait and see. There'll be lots of groundwork we need to lay in terms of getting that submission in front of the right people, in front of new ministers, new MPs, new shadow cabinet ministers, etc. So it's certainly not, while that submission's been put in, there's lots that we can do to build on it. Last year, we also did see that the Department of Finance did a secondary pre-budget submission process because Parliament was prorogued last summer. And so we may have an opportunity to revise and resubmit. So we just, all this to say, thoroughly appreciate folks, their feedback on additional advocacy and additional points we can incorporate, because that's something that will become a huge focus post-election is getting IPAC Canada back out in front of parliamentarians. And I think as Eric has highlighted, with the very high likelihoods, and he's certainly the polls expert, of a minority parliament, I think that becomes even more important in terms of getting IPAC Canada in front of not just whoever is the governing party after the election, but all parties and folks in different leadership positions within their party caucuses resources as well. And so that's really, really key. And that's something that we will certainly take back and really appreciate the feedback on. And then just to comment on the second question that came up about, individual public health units and budgets being allocated, or healthcare budgets, a very small portion of them going to public health. I think that's a really, really important consideration and something, talking about a standards approach nationally, whether it's for surveillance, whether it's for something like long-term care. I think looking at the party platforms, we're seeing a huge appetite for that type of standards approach. So it's something that I think we can build on in our post-election advocacy. The biggest example that comes to mind for me is long-term care. Last November in the Liberal government's fall economic statement, they announced putting forth standards for long-term care. And you're seeing that idea percolate in a lot of the party platforms, whether it's on long-term care or other types of infection prevention and control relevant issues. I think we are seeing, and I think Eric mentioned earlier, kind of the patchwork approach to the pandemic, that there's definitely an appetite for that standards approach, not only in long-term care, although I think that's one that most people agree we need to tackle imminently. So I think that there's some leeway for me looking at party platforms and particularly planning for the likelihood of a minority parliament. There is some points of convergence that we can build on, certainly in our post-election advocacy. So, but really appreciate the additions and feedbacks. I think they're excellent points for us to build on as we go forth after the 20th.
Thank you, Brianna, for those comments and for bringing in the conversation around long-term care. And so I would turn to Eric almost for clarity or for agreement, that because long-term care is another one that I'm not really hearing that it is the platform that people are going to get elected on or not. Is that, again, because we're all in agreement that it needs the support? And then how do we make sure that it doesn't lose its platform, that everyone agrees that it's there, but then after the pandemic, even after SARS-1, we saw the resources, we saw the buildup. And then in fact, just before or in the middle of the pandemic, I started to see some decisions almost look like we were going back before SARS-1, which really worried me. And so I worry that at the end of this, people will just, it'll get turned off.
Yeah, I'd say that's sadly a legitimate concern, right? There's a lot of issues that have been raised by the pandemic, issues around inequality, for example, that people might move on from. Now, certainly people who might have lost people in long-term care centers, they're not going to move on from it. And I think that what you highlighted as well, that because all the parties agree that it's awful and we need to do more, there's not a lot of reason for them to try to wedge the other parties. It becomes something that they have in their platform just to make everybody feel comfortable and know that they care about this, and then they can talk about other issues. But I think that we saw, for example, on the debate when Justin Trudeau, one of the questions he got was whether he would put his mother in a home. And while people might not be really thinking about these kinds of things now, eventually people are going to have to be making those kinds of decisions, right? So people who today aren't old enough to go into a home, or their parents aren't old enough to go into a home, in 5-10 years, they might have to make that decision, right? So I think it is going to be something that's going to be on people's minds, because I think a lot of people are going to be wondering about how can I stay in my home for as long as possible. So while I don't think it'll be the same kind of issue in terms of its importance as it was for a lot of people just last year, I do think it's going to not go away as much. SARS, for example, not the kind of issue for most Canadians that the pandemic has been in terms of its impact on their lives. People are going to remember this as a moment for the rest of their lives. It's going to be like, 9/11 or when JFK was shot. So these kinds of issues, people will be able to just bring up what happened in the long-term care facilities, and it'll bring up the same emotions. But yeah, it's not going to be top of issue, I think, for the parties, because there might not be that much to gain from it politically, sadly.
I can tell you from someone who was assisting in long-term care, I've already had that conversation with myself. I know how long I want to stay in my home for, but I've also seen a number of people who have been supported, assisted, and cared for through that system. And so would be really sad to see that it's not continued to have a focus to be able to get the kind of resources that it needs, and keep some of the resources that have already been embedded into the different services. Do any of our other panelists have any comments related to some of the work that we might be able to do to support long-term care?
Sure, Zahir. People don't always go into long-term care by choice. They have needs that can only be met in that sector, that can't be met through other mechanisms. They don't have the resources either in family or financially to manage to stay at home all the time. And I think it behooves us as a population to make sure that this is our platform, our diving board to take off and do something to improve the situation in long-term care. As a Canadian, I'm devastated and embarrassed by our performance through this pandemic. And, as I mentioned earlier, there's clear, unequivocal evidence that infection prevention and control knowledge and resources were absent in this sector. So although all 5 parties have language to support long-term care, and they talk about, having a focus on renovation of homes in all the provinces and territories across Canada, they talk about implementing strict infection prevention and control measures by having facility inspections, in fact. And the block is a bit wide. They just are proposing a series of measures to improve the life of seniors. We need to step up to the plate, and they must have an infection control voice to assist them in making sure that the standards and infrastructure that they're developing and following actually protect residents from infectious diseases. Improving infection control in long-term care and addressing those long-standing issues is critical to protecting our seniors from COVID-19 and all sorts of other deadly infections.
Thank you, Colette. With a few minutes left, one of the things I wanted to ask you were, are there any particular places that our members could get valuable information or reliable information that would help them piece through some of the complicated jargon that the platforms may have, or when trying to figure out what's in behind some of the words that they say, what they might be able to rely on?
Well, I did take a look at the IPAC mini site, which I thought was actually quite helpful in terms of laying out the different things from the platforms. I know that the CBC has a platform tracker or comparison tool where you can compare the different parties on the various issues. I know that also the CBC has the Vote Compass tool where they have some questions related to healthcare, but a lot of the media websites now have more tools to try to help people compare these platforms. So I would suggest taking a look at that. But again, I did find the IPAC one quite good.
Thank you. With that, I'll ask Brianna, because I think she was involved in being able to do that. Are there some additional resources that you might want to point our members to be able to help? I know Jerry's on the line as well. If there's other resources as we get to the final days to be able to sort out, we really do want to encourage everybody to make sure that they get out, to take everybody in their family with them that has the opportunity to be able to vote, to be able to wait through the lineups and get your vote said. But are there resources that we'd like to make sure that they know about?
Yeah, absolutely. Of course, super biasedly, I'm also a big fan of the strongerandprepared.ca site that we put together. Really, I can take ownership of that. Our team at Impact did go through all of the party platforms, so IPAC Canada members don't have to go through 100+ pages of every party platform and pull out what was most relevant for you folks. So those are the memos that are included on the site. So just by scrolling down and clicking on any party's logo, you can have a synopsis of the most relevant points of the platforms for IPAC Canada members. If you didn't have a chance to tune into the debates or only tuned into part of it, there is also some debate summaries there of the TVA as well as the French and English debates. Again, as we've talked about, healthcare hasn't been the top issue, and therefore it hasn't been the top issue discussed in those debates, but there are a few key points. And even if you're just interested in getting an overall summary of those on issues outside of healthcare as well, one of the really poignant moments for me actually in the English debate was the question that Eric mentioned earlier around the Prime Minister being asked, would you put a loved one in a long-term care home? So there is some sections there that you can scroll through and pick out those summaries as well. So would highly encourage you to do that. The other point that we wanted to create that microsite for was to create an outlet for IPAC Canada members to engage in the election, not only of course, consuming the information to make their choice at the ballot box a little bit easier to parse through all of the info that's out there, but also to engage with their local candidates. So I know Colette touched on this earlier, but there is a form letter and a tool, a digital advocacy tool embedded into that site, which you can select which candidates from your riding you want to write to and let them know that you are an ICP in their riding that they're running to represent. And so there are, we're running short on campaign days, but would really encourage you to send a letter to your candidates and lets them know who you are and what IPAC Canada does and what some of those top concerns are for ICPs. And I think that's really, really important. I'm just gonna, as we run short on minutes here, I'm just gonna say, I think it was mentioned in a few of the questions that some folks maybe didn't know what an ICP was or what IPAC Canada does prior to the pandemic. And I know in a lot of conversations I've had with folks like yourself, Zahir, and others on the board, they've had friends and family members come up to them during this pandemic and say, oh, I get what you do now. And I get why it's important. And that's really the recognition that we have in this moment that I think we need to really build off and take advantage of. And part of that is getting people in front of the knowledge that there is an association, IPAC Canada, that is representing ICPs and has this very specialized knowledge in preventing and controlling infections. And so I think the more candidates we can get that in front of, that gives us a great runway to jump off of in our post-election advocacy that I touched on earlier. So I encourage you to check out the microsite, but like Eric said, a lot of the news outlets do a fantastic job of also parsing through platforms and pulling out key themes. So definitely check it out. And I'll echo Zahir's comment to definitely get out and vote.
So thank you, Jennifer, for sharing the microsite. It is in the chat box for those of you that would like to take that link and jump off to be able to get some more information about the candidates. This would be the last call for any questions, if there are any. But I do want to take the time to thank all of you for taking the time to be able to speak to our members. Colette and Jennifer, you're both active members of our IPAC board, and so it's been grateful to be able to have you to be able to speak on behalf of some of the work that we're trying to do and what we're advocating for. Eric, thank you so much for taking the time. We know you're jumping around from a variety of different meetings, but it's been really helpful to be able to have a better understanding of what we might be able to use to make some of the decisions and have some of that insider information. And so thank you so much for taking the opportunity to speak to us. And with that, thank you everyone for joining us this afternoon. You know where to reach your board members if you've got questions, or Jerry Hansen, our Premier Executive Director for IPAC Canada. But thank you so much for taking the time to join us today. We really do encourage you to be able to get out, have your voice heard, and make sure that your ballot is marked on September 20th. Have a great afternoon, and we'll talk to you soon.